Good evening. Welcome to The Next Word. I'm your host, Chris Warnke, and tonight we're going to have a conversation about Social Security. We have a veteran of Capitol Hill who is now the CEO and president of the National Committee to Preserve Social Security and Medicare here in Washington, D.C. And we owe a tremendous amount of gratitude to Max Richmond. Max, we do. And I had no idea of your early career you were the staff director of the Senate Committee on Aging.
That's correct. First of all, thank you for inviting me
thrilled to
be
have
on
you
the
here.
program.
I'm thrilled.
And I was staff director of the U.S. Senate Committee on Aging back in the 80s and early 90s.
Right. You're too young.
And that's where my interest in these issues began.
This is terrific. So, and that's how you got involved in politics. You're a Harvard grad, correct?
Georgetown Law School,
Georgetown
Harvard
Law.
undergrad.
You were born in Nebraska, correct?
No, I was raised in Nebraska. I was born in Germany.
Okay, that's right. You were born in Germany,
And
but raised in Nebraska.
raised in Nebraska.
So a boy from the Midwest comes east,
Yes.
gets an incredible job on Capitol Hill.
36-hour train ride from Omaha to Cambridge, Massachusetts.
And that's what you took?
That's right.
No, 36-hour train ride.
Yeah.
Wow, it's amazing. Amazing. So you got down here and you started on Capitol Hill?
I started working for a congressman from Chicago, Sid Yates, who was a chair of one of the appropriations subcommittees, and worked for him for a couple years. Then I was hired by a House Senate commission, and then by a U.S. Senator, James Aberbrest from South Dakota.
From South Dakota.
And then John Melcher of Montana, and I'm here.
And you worked for some great people.
I did.
You know, I don't think a lot of people know about the whole history of Social Security, how it came into being, which was I'm fascinated about because it really started during the Civil War.
Right. But it was, you're right, it's a long history. It took a long time to get to the point where President Roosevelt was able to get the support in the Congress and in the country to create the Social Security system. And, you know, it's been around since 1935.
Right.
Everybody who has ever been entitled to receive benefits, who has qualified, has received them on time. So it's a pretty good program. You know, most federal programs, and I worked on Capitol Hill for 16 years, most programs many times run out of money before the year's over. They have to go into the Congress and ask for supplemental funding. Social Security has never had that issue. It has been, it's really a ingenious program in the way it was set up. And I just wanted to, for your audience to understand the connection between our organization and President Roosevelt. A former congressman named James Roosevelt, who had served in the House from California, in the early 80s, he had retired from the Congress, felt that Social Security was under threat by the new administration, President Reagan, and so he thought he would found an organization that would preserve what he felt was his father's greatest legacy, his father being Franklin Roosevelt.
Oh, what? Oh,
Our founder, James Roosevelt, was the oldest son of President Franklin Roosevelt, and that tie continues. The vice chair of our advisory board is the son of our founder, James Roosevelt Jr. You may know him from Boston. So there's a lot of continuity there over many, many years.
And so he decided this committee was important.
He did. He thought it was important to protect the program and the people who benefited from the program. And shortly after it was created, he took on another important program, and that's the Medicare program.
Right.
So we became the National Committee to Preserve Social Security and Medicare.
And it's a formidable organization. You're right on Capitol Hill.
We're right on Capitol Hill. We're We're different from other senior organizations. We work with all of them at different times, but we are very political. We have a political action committee. We contribute to candidates. We have a scorecard. We rate members of Congress, incumbents, and that goes out to our membership a month or so before the election, and we will delineate votes, some 8, 10, 12 votes during that Congress that we have notified those members. We're going to count this. You know, it's not a surprise. Don't say it's a surprise. We send a letter and say this is a vote that's going to count.
Oh,
and
absolutely.
then we issue it to our members. And of course with challengers, and we do support many challengers, we have a process where we'll interview a candidate, a challenger, and since they don't have a voting record, and they fill out a questionnaire, they meet with our political action committee board for an hour, hour and a half, and take questions, and then we decide whether we're going to support them or not.
That's terrific. So now there are more than 100 women who have been sworn in
Yeah.
to the House of Representatives just recently. This is exciting because this could change the debate.
It could change the debate. I think it
And
will change.
expand
I think it will
program.
change the debate. I think at least we're going to have serious discussions about issues that have, been maybe on the back burner in the past.
Right.
Issues dealing with, in our area, Social Security, trying to make sure that women are treated fairly in the Social Security program. And I'll give you an example. Right now, women often have lower Social Security benefits than men. Why? They made less money,
Right.
so they contributed less in many cases, so
Right.
the formula results in lower benefits. In addition to that, women, as you know, often leave the workforce much more so than men to raise a family, to care for children, to care for older relatives, even though they might not be their own parents, but they often are the ones that step forward, and so they have to leave the workforce to do that. So they have they have fewer years that they contribute into the program. That also affects the formula that determines their benefits. So, you know, it's with women now having so many new women elected to the Congress, hopefully some of these problems that I just discussed can be dealt with. For example, we have worked for a number of years on a plan that would give a caregiver credit for someone who leaves the workforce to care for children or an elderly member of the family. And there would be a formula where they would have so many credits applied to their work history that would be fed into the formula for determining their Social Security benefits. This would help women who are the ones that often take on that role. In addition, women live longer than men.
Right. Longevity.
And they need Social Security longer. There are proposals which have been floated in the past few years. We hope they'll get some serious attention now, that would give a boost to those Social Security beneficiaries 85 and over. Those are more often women than not. They live longer. They rely on the program more than men do because they are living longer. So these are, they're two changes that what I think would make a dramatic change in the lives of women, older women, and younger women as well.
So the program started as sort of a social insurance program for our military, and then it was extended to the widows of the military, correct?
Right.
There are a lot of women and men today that are taking care of their veteran spouses. Have you thought about, ones that they're caregivers now, they've left the workforce, and they're taking, they're assuming the role of a caregiver. So this would include maybe.
Yes. This would bring more, I guess you could call it equity, to those who choose to leave the workforce to take on that important responsibility and make them as whole as possible. The other issue that affects everybody, but particularly women who depend on Social Security more because they live longer, is to have a cost of living adjustment, a COLA. Very important.
Yes.
Anybody who's a Social Security beneficiary is very tuned into the fall of every year when the announcement is made of what the COLA is. Some years the COLA has been zero.
Right. I was going to say that's
In
been
2000, I believe 9 and 10, or maybe 11, the COLA was zero because the formula that determines what the cost of living adjustment is based on inflation. But it is based on inflation as it impacts a working person, not an older person. So it doesn't take into account inflationary's impact on things like health care, which older people use much more.
Right.
And you know, one thing that I really struck me in those 2 years where there was zero COLA, one of the main reasons that COLA was zero is gasoline prices, if you remember back then, dropped dramatically. That pushed the calculation of inflation for Social Security purposes down because gasoline prices were so low. But guess what? Seniors aren't the ones that are driving to work every day. They're not using gasoline as much. They're not dropping children off at school, picking them up. So it affected them in a way that did not actually reflect the kinds of things that they relied on. So some of the proposals that I've mentioned would also have a change in the formula that would reflect inflation as it affects a senior, which is the whole purpose of a Social Security check and the cost of living adjustment.
I know. Yeah, that's fascinating. So now that the shutdown, people are, it's not impacting the Social Security check that's going out to the recipient.
No, it's not.
It's not, which is wonderful.
No, it is. And, you know, that's something we're, of course, very concerned about.
Well, absolutely. I don't think people realize that.
Yes. At this point, so far, the Social Security system has not been impacted. I hope this ends soon.
Yes, I think it will. I have a prediction it's going to hopefully end very soon. In terms of tax, the benefit, is the benefit taxed?
It's taxed if you're earning above a certain amount of money.
Okay.
And you know you're still working.
Right.
And you're earning above a certain level, your benefits are taxed. A lot of people have a problem with that because they think, well, we're already taxed once, and now you're taxing our benefits. And we actually opposed, early in the Clinton years, there was an increase in the tax on Social Security benefits for those people who met that threshold of income. And we opposed that, but we were able, you know, you mentioned how active we are politically. We were able to make sure that the increase in the tax, and a lot of people don't know that, that was placed on Social Security benefits was dedicated to the Medicare program. So many Social Security beneficiaries also participate in Medicare, and this helped extend the solvency of the Medicare program.
Oh, that's interesting. This is great. So we're going to take a short break.
Okay.
We'll be right back, and we'll talk further. You're watching The Next Word. We're going to take a short break, and we'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
Welcome back. You're watching The Next Word, and our guest tonight is Max Richmond, CEO and President of the National Committee to Preserve Social Security and Medicare. And what a job. What a job, Max. Thank you. Because it's, you know, it's yeoman's work.
It's a big job for one of the best causes
in
this country, in my opinion.
No, it's tremendous, and thank you. And we owe a debt of gratitude to you, because there's so much debate about looking at entitlements now and domestic spending and entitlement programs in particular. And you know, it's a little frightening.
You know, I've been trying to change the language around this program and get away from the word entitlements, because Social Security is not an entitlement. An entitlement, in my mind, is something, a benefit that you receive because you're living and breathing. Social Security is a program you pay for, you pay into it with every paycheck. That FICA tax is withheld. You are paying for insurance. You are earning a benefit.
Right.
This is an earned benefit, and language is important.
It is important.
Because if more people felt this was an earned benefit, something you pay for while you're working, it is yours. It's not something that is gratuitously given to you. It's something you pay for. Now, an earned benefit that you know, we know the term FICA.
Right.
FICA is Federal Insurance Contribution Act. Social Security, FICA tax, Federal Insurance Contribution Act, funds old age survivor and disability programs. I have been trying for quite a while to convince younger people that this is a program that has benefits to them, not only for their parents, their grandparents, but for them. As an example, if you are a 27-year-old worker with a spouse and 2 children, you have right now, never mind what happens when you are 66 or 67, you have right now about $500,000 in value of life and disability insurance if something bad happens in your family. And a lot of people don't know that until someone says, say, you know, you should talk to Social Security. The breadwinner became disabled. 3 million children get Social Security benefits because they have a parent who died young or became disabled. So it's important that people understand what this program is. It is insurance that you're buying while you're working. You don't know how long you're going to live. You don't know. That's the whole point of insurance, of how you're going to need it. But it's there for you. And I think more and more people, younger people, are going to appreciate the value of Social Security. You know, years ago, Social Security would send employees to high schools to talk about Social Security and how it worked and how important it was for families, not just for seniors, but for families.
Absolutely.
That stopped some time ago, and we're doing our best to fill in that void.
So what are you doing with the millennials right now?
Well, we're
really educating.
Yes, we're educating them. We're participating in programs, town hall meetings around the country, sometimes with other organizations, to talk about the value of Social Security to families.
Is it resonating?
I hope so.
Yes. What about the campuses? College campuses?
Well, you know, we had at one time, we had a couple of younger staff people, and we will try to do that again, that would engage on campuses, because you're right, that's important. And it's sometimes easier for a younger person to have that conversation. So I'm hoping we can get back into that.
Yeah, but it's a mindset that, you know,
exactly.
you need to educate, because you don't realize people, you know, younger people who enter the workforce, of course, they think, well, okay, I'm not going to retire for another 50 years or you know, 40, 45, 50 years, and so it's so far out that it's just, you know,
well,
it's hard to
that
comprehend.
speaks to the importance of recognizing the value of this program, not just when you retire, but in case you need it, need help in your family.
Oh, it's wonderful. I mean, my own family, you know, were recipients. My sister and brother, you know, their father died, so, you know, it made a huge difference.
Absolutely.
You know, a huge difference.
Absolutely.
You know, but going back to the women, you know, I know you advocate, and you had an incredible, your predecessor, Barbara Kennelly.
Yes.
She was a huge advocate for women.
Yes.
What do you think? I mean, with this new Congress moving forward, you've got an interesting makeup. You certainly have an incredibly new women population.
Of course, we have a woman Speaker of the House, which
Absolutely.
is for the second time.
Right.
Same person.
Same person.
And
Wonderful.
there isn't a stronger advocate for our programs than Speaker Pelosi. And in fact, the chair of our board, Catherine Dodd, was the district director in San Francisco before she retired for Speaker Pelosi. So we have a connection with that office that is, I think, very, very important and valuable. But, you know, we wanted to say a few things about Medicare, I think. That is in our title, Social Security and Medicare. Medicare is a great program. I have done hundreds of town hall meetings around the country, hundreds, mostly with members of Congress. I've never met a senior who would be happy to give up their Medicare. They love their Medicare. But it's not a perfect program. There are gaps in the Medicare program, things that it does not cover. And one of our goals this Congress is to try to push legislation through that has been introduced again and several times in the last 5, 6, 7 years, but has never had the support it needed to get through the Congress. I think that's a little different now. Medicare does not cover vision. It does not cover dental. It does not cover hearing.
Pharmaceuticals?
It has since 2003 had a prescription drug, and that was a big move to have prescription drugs covered under Medicare Part D, and that was in what's called the Medicare Modernization Act of 2003, and that was a huge step, and a good step, not perfect either, but there's legislation. Debbie Dingell, Congresswoman from Michigan, has introduced a bill that would start some coverage for hearing testing and hearing aids. Congresswoman Roybal has introduced a bill that would cover all three, hearing, vision, and dental. Maryland's great Senator Ben Cardin, and we just met with him, I think about 10 days ago, is pushing through a bill that would add comprehensive dental care.
I was going to ask you about dental care.
For Medicare beneficiaries.
Oh, that's terrific.
And you know, the reason these are important, it's not just, dental care is important not for just cosmetics, it's important for nutrition. There are studies that have shown there are connections between poor dental health and other serious illnesses.
Oh, absolutely.
Hearing loss is, we worked with a doctor at Johns Hopkins who I think has made the connection between hearing loss and dementia. And it's not just about social isolation, it's about things that happen in the brain that are a result of hearing loss that lead to dementia. So we need to look at the big picture.
Right.
And yes, it would cost money to make these improvements. It could save a lot more money down the road.
Absolutely.
And this is a challenge that we're going to be looking at in this Congress, adding these important benefits to the Medicare
That's
program.
wonderful. So does your organization, do you fund any kind of research with universities, or do you do joint projects?
We don't fund research projects. We don't have that capacity.
No,
but for example, this Dr. Lynn at Johns Hopkins, we were able to bring him into meetings and hearings we had with House members who are on the Appropriations Committee that fund NIH. We had a terrific meeting with Congresswoman Rosa DeLauro. We're trying to increase the funding into research on that connection with hearing loss and dementia to make it even clearer, and that will help us make the case to add hearing coverage to the Medicare program.
So looking forward here, because we haven't passed the first hurdle, which is overcoming the shutdown, but in terms of the president's budget, I mean, last year there were some proposed changes. What do you anticipate this year?
Well, I don't know. I wish I did know, but I watched. There were 17 Republicans running for president in 2015 and 16. I think I watched all those debates. It was a lot of debates.
A lot of debates.
And President Trump's the only one that said time and again, I won't cut Social Security and I won't cut Medicare. that hasn't quite played out. He hasn't cut the benefits of the Social Security program, but he hasn't been able to support adequate funding to run the program. And that's what we've been pushing. We'll be very interested to see what the budget shows for both Medicare and Social Security. The disability program in Social Security. You may know people that apply for disability. If you apply for disability, chances are you will be denied. You will be able to have a hearing. It usually takes about an average now is 700 days to have a hearing.
Really?
Because there are not enough.
Because of enough people.
They don't have enough people.
Staffing.
They don't have enough administrative law judges. They don't have enough clerks. So, you know, you have a disability.
Right.
You are appealing a denial. You're going to wait 700 days. You know how many people die waiting for a
700
hearing?
days. Oh,
Lots
geez.
of them. So we need to, what we're going to work for in this budget, if the president does not include it, is additional funding to properly run the disability programs,
great.
to staff the Social
great.
Security office.
Okay.
You know, there
I had
are
no
offices
idea.
closing
Two things
all
that
over the
yeah.
country, and people, usually low-income
And
people.
they're closing.
They're
Well,
closing.
they're closing because of funding.
They're closing because of funding. They just closed one in Baltimore. They just closed one in Arlington.
Really?
They just closed one not long ago in Milwaukee. And those people that are served in those offices
Right.
are told, well, there's another one. Well, it might
In
take you an
another
hour and a
state?
half on public transportation to get there if you want
Well, that's a
to
shame.
get some
Jeez,
information or
huge.
need some
It
help.
is.
And then there's the toll-free number, which is a good idea if someone ever answers.
Right.
And I testified before the House Ways and Means Social Security Subcommittee about less than a year ago on the funding of Social Security and made the points I've just made. Increased funding for administration, for the staffing, and we call the toll-free number. We had someone on my staff behind me call the toll-free number. When I started my testimony, an hour and 30 minutes later, I was still on hold.
Oh, wow. Wow.
So we're trying to demonstrate the need for adequate funding in the president's budget. If it's not provided, hopefully our friends in the
Congress.
House and the Senate will boost that budget.
Wow. Amazing. A lot of work. But thank you. I mean, it's amazing that you have what you've done so far, and you've got.
Thank you.
These are issues that truly people don't realize. I had no idea about all the closings. In fact, I had thought there was a closing here in even Washington, D.C.
Well, the
the
ones that I
one-
mentioned, we had a rally with
Right.
some of the labor folks in Arlington, in Baltimore. You know,
Huge.
I think
Impact.
members of Congress don't appreciate how difficult it is to get information.
Absolutely. Yeah.
And you know, there are offices that are much more convenient, designed to help members of Congress and congressional staff, which is fine, but make that available to everybody.
Everybody. Oh. Well, thank you. We'll have you on 6 months to see.
Well, I appreciate the
What
opportunity.
progress we've made.
I really appreciate
Thank
it.
you, Max. Really.
And
You've
look
been
forward
a friend,
to being on.
and thank you. And yeah, we'll have you back.
Thank you.
You've been watching The Next Word. Have a great evening. Good night.